Hello, good morning. It seems dentists these days are just not satisfied in pulling teeth. They're vying to pull follicles as well. And now this curious turf war between Indian dermatologists on one hand and Indian dentists on the other over hair transplant surgery in India has entered the Indian courtroom. As we await the most honorable court's final judgment on this contentious issue, to keep updating my curious subscribers in the meanwhile on developments in the field of hair transplant in India, I seek now to dissect this issue with the precision of a sapphire knife and pose 5 questions to dentists who aspire to plant roots where none belong. Stick around as I unfold this dental drama, how I see it. In all my 35 years of surgical practice, of which 28 have been as a plastic surgeon, I've encountered hair in the most unexpected places, but never in the oral cavity. Yet some dentists seem eager to tread where no strand has grown before. They've even sought legal sanction for surgical parity with dermatologists and plastic surgeons. Now here's the kicker. I've yet to see a dentist performing a hair transplant surgery openly having declared his dental background to the patient. Now why this cloak and dagger approach? If you're confident as a dentist in your skills, in your surgical skills and public acceptance when you indulge in hair transplant surgery, why not hang a board outside your practice which boldly announces hair transplant by a dentist? And let's see how many bald patients knock on your door to seek follicular salvation. The idea of a dentist seeking to encroach upon the field of hair transplantation is akin to a dermatologist getting up from the wrong side of the bed one fine morning, announcing that he'll start to extract molars starting this new year. Both these scenarios are laughable, yet the courtroom battle rages on. Don't for a moment get me wrong. The root of the issue is not just about surgical skills. It's the artistic, aesthetic, and technical mastery required to perform modern-day hair transplant surgery. Crafting a natural hairline demands an artistic eye, a steady hand, and an intimate understanding of scalp biology and wound healing. Besides the processes, what goes into a surgical procedure. Extracting a wisdom tooth doesn't exactly prepare you for the nuances of follicular unit extraction, and least of all to handle the complications that may ensue when you administer 10,000 cuts in the same scalp in one single day. This debate also underscores a troubling trend. Professionals venturing into unrelated fields for financial gain. Such cross-specialization threatens to dilute standards of care and place patients at unnecessary risk. This is the biggest danger lurking, and I'm sure the learned Honorable Court is aware of the repercussions on a broader canvas in other fields as well. If dentists want to diversify, why not diversify into areas where their so-called stated surgical skills are desperately needed, like burn care or emergency wound management? But if they are quiet on this, the answer, my dear friends, is clear. Hair transplantation is a lucrative field and it's the path of least resistance. When you have exhausted your own specialty or you have been a loser in your specialty, it's a good time for a hunter-gatherer to venture out beyond his known domain and start to encroach, start to prey. Next, hang on and hear the 5 questions I pose to my dentist friends who have likely gone astray. Please answer these 5 questions before you put out a case for doing hair transplant surgery as a dentist. Number 1, why only hair transplants? Why not serve in emergency rooms or manage burns where real shortage of surgical skills exist? Number 2, do you inform your patients that you're a dentist when you're doing a hair transplant? Do you disclose your identity of your specialty, your field of training, that you're not a plastic surgeon, that you're not a dermatologist? Do you inform them? Thirdly, will you specialize entirely in hair transplant surgery? Will hair transplant surgery become your full-time prime focus? Or is it just another service on the menu to add revenue to your depleting resources, your depleting practice? Fourthly, are you okay with reciprocation? Would you accept dermatologists and plastic surgeons offering dental veneers, offering molar extractions, and a host of other dental practices? And lastly, in your clinic, when hair transplant is being done, who is actually doing the work? Is your surgical skill, stated surgical skill, coming in handy, or you're employing untrained technicians and nurses to do the procedure for you. Courts, in their wisdom, should investigate whether untrained staff are being employed for these procedures, whether the surgical components of this practice, hair transplant surgery, is being delegated to non-medical staff by those seeking surgical parity in this field. The patient's trust, after all, is the bedrock of medical practice. A hair transplant, besides being a surgical procedure, is the promise of confidence through enhanced self-esteem and natural results born out of rigorous training in universally accepted norms of institutionalized teaching and training programs. By stepping into an unfamiliar territory, an unfamiliar specialty, dentists risk compromising both. And who will suffer? So to my dental colleagues, I offer this light-hearted advice. If you're keen to dabble in hair, why not start selling wigs? Start selling topies. It's non-invasive, it's reversible, doesn't require courtroom drama or even a sapphire knife, and it is lucrative as well. Thank you for watching. Most sincerely, from a plastic surgeon who knows his follicles from his fillings. Have a nice day and God bless you.